move beyond those bad times now.
Oh, okay.
Well,
So sorry.
yes. Well, okay. I'm glad that we have more people joining. So I'll go ahead and introduce some of us on the call and have a bit of a shorter version of the deep learning in healthcare session as part of this, Combat COVID-19 launch. I am Alexander Tsado, originally Nigerian, but I live every day representing all Black people around the world. I'm currently calling in from California. I co-founded Alliance for Africa's Intelligence, Alliance for AI for short, and incredibly proud of all that has been presented today. I believe a key theme of today is being able to leverage technology to drive change especially in times like these of the COVID-19 pandemic and lockdowns, is how we can use technology to increase access and to solve the many problems that we're going to be facing. And so for today, I will be introducing and, Julio, who is calling in from Angola Cables. He will at least tell us a little bit about himself, about his solution as relates to deep learning in healthcare. After which I will do similar. I'll take a few questions and return everybody to the main room. And so without any further ado, I will call on Julio to please, first pronounce your name properly, because I'm sure I'm not doing that right. And tell us more about yourself, your presentation, and we will take it from there.
Okay. Hello, everybody. Let me just check here if I have. Okay. I think I can join with San Francisco.
Great. And if you can put on your video, that would be great. Otherwise, just share your screen and we're good to hear your presentation.
Okay, so my name is Julio. Julio in Portuguese is Julio Chilela. Yes, I am from Angola. I am a PhD student. I'm taking computer science and focused on artificial intelligence. I am also a data engineer in Angola Cables, which is telecommunication company, international telecommunication company. We have submarine cables, fiber optic cables that is connecting Africa to America and Europe. So I work a lot with the different type of areas in artificial intelligence. I work with the image, I work with the regular, raw data. And I will be presenting my topic in deep learning for health during and post-COVID. Yes, Alex, you can go.
Wonderful, wonderful. Thank you very much. Honestly, you can actually go. Since we're doing a shorter version of this, given the technical challenges and we started a little late, it'd be good to hear the presentation that you have, after which I will share mine. We'll take some questions from the audience and then return everybody to the main room. So really, the floor is yours, Julio.
Okay. Awesome. Let me see if you can you see my screen?
Wonderful, it shows, yes.
Okay, let me just minimize this. Okay, this is deep learning for health during and post-COVID. So, which is the topic that I will further explain. So, why deep learning? What is it actually? So deep learning is an artificial intelligence function that imitates the working of the human brain on creating and processing data and creative patterns. So in deep learning, we have like models that filters the information in different layers. And from these layers, it can actually predict and give you a result. So deep learning is just a subset of machine learning in artificial intelligence. We have machine learning on like a global area, and deep learning. We have artificial intelligence as a global, and we have machine learning inside, and we have deep learning on inside of machine learning. So here, I don't know if you can see my mouse, if I can point it out.
Yes, we see the mouse pretty clearly.
Okay, good. So if you see here, this is just an imitation of deep learning model, how it works like a regular neural network. We have different hidden layers, and we have the input here and the output on the other side, and you feed the information here, and it will come out the thing that you want to learn from here. So architecture on deep learning, we have deep neural networks, we have deep belief networks, we have recurrent neural networks, we have convolutional neural networks. So all of these can be applied in fields like computer vision. Some of these can be applied in the field of computer vision, machine vision, speech recognition, neural language processing, natural language processing, sorry for the error here, audio recognition, social network filtering, machine translation, bioinformatics, drug design, or medical image analysis. So all of these are fields of where we can apply deep learning architecture. So for health, we have here deep learning in the middle, and we can use deep learning in different areas. I actually I'm summarizing here some of the areas where we can use deep learning. Here, finding a vaccine, detecting breast cancers, detecting brain tumors, detecting lung disease, interracial hemorrhages, controlling the spread of some specific disease. In our case, we have, like right now, COVID-19. We can control it using some deep learning techniques, and it can also help in clinical decisions. So all of these, we can train algorithms to recognize and help humans to achieve their goals. So why deep learning during COVID? So COVID-19, as I think everybody already is tired of hearing this definition. COVID-19 is an illness that is caused by the coronavirus SARS-CoV-2, and it affects your respiratory tract infection. So you can have effects in your upper respiratory tract or lower respiratory tract. So I have here an image where we have lungs and maybe locations where you can have the virus. And so why using deep learning is to identify patterns in this type of image. So using deep learning in the field of computer vision. So I will give you a practical example. So how here in Angola we are using computer vision to help detecting the virus in a person. So we have built the COVID vision. COVID vision is artificial intelligence software that it can provide a fast and efficient pre-diagnosis and identification of COVID-19 case. So the COVID vision platform analyzes X-rays and CT scans from radiologists and medical practitioners. They can rapidly identify the positive prevalence of the COVID-19 virus in a patient. So, and it reduced to 15 minutes or more to detect the virus, and with more than 90% of accuracy. So why COVID division. It helps to accelerate the detection of the virus, to mitigate the lack of testing, the massification, and to make it and cheap the testing process. So we took a lot of image as input, COVID, non-COVID, and pneumonia, X-rays and CT scans, and we feed this quantity of image in a convolutional neural network to train a model to identify the characteristic of these three different X-rays or CT scan, and then to learn to say, hey, this is COVID-19 or a non-COVID-19 or pneumonia image. So we have more than 2 terabytes of image. We collected a lot of them online to train our models. So we have artificial intelligence in the middle, and we have image from different people with the patients with the COVID, non-COVID, normal, and pneumonia. So, and it can also gives you explainable AI, so it tells you why it says that, hey, this image is an image from a COVID-19 patient. It can explain to you the areas where it found evidence of the virus, and tells you the percentage of the that the virus is affecting the lungs. So this is an overview. You log into the platform, and then you can register a patient, and then you can submit here an X-ray, USG, or computer tomography. You choose the file, and then you upload the image. You select the image, and then you upload. After that, the artificial intelligence, the convolutional neural network model will give you a percentage of the virus in the image that you just submitted. For instance, in this one, it is telling you that, hey, this guy is 89% COVID-19. And then this is 32% is a non-COVID-19, the final response, and so far. And it also gives you the explainable AI image. And so after that, so after COVID, where we will be using deep learning. So I presented before this image as an African. So I presented before the image of this image with the different areas that we can use deep learning to help in health for us in Africa. And we have here, so as an example, here in Angola, malaria is one of the disease that is devastating us. It's killing a lot of people, and we have deep learning models helping to analyze and detect malaria. And we also have here breast cancer. We can use deep learning for this area. We can use deep learning for brain tumor to detect and help doctors to actually follow up with development of the tumor in a patient. And we have here deep learning also be using, if you Google Simon, you have here deep learning helping in vaccine responses. So we have a bunch of fields to still keep using deep learning after COVID. So what we have to do is go and get it done and take it to the practice and give it to the doctors to help them. So thank you.
Fantastic. Thank you so much, Julio, for that great and inspiring presentation. It's really, really incredible to see just what's possible with deep learning in healthcare, how you're able to use it to solve problems that were previously impossible, especially in times like this with COVID-19. I think at the beginning of this scenario, of this pandemic, It used to take many days, several days to get the test back from COVID, right? Even some parts of the world today, it still takes many days. But with deep learning, there's a possibility of doing it in a couple of minutes. This can save so many lives. That's why we're having these conversations, to see how we can bring this to more African spaces and to the rest of the world. Yes, I'll have more questions for you, Julio. But I will take some time now to just do a quick presentation from this end as well. And then we'll see who has some questions from myself and from the audience. And to that point, please, audience, place your questions on the chat window. We will see them and we'll answer them before it's time to return to the main room. As far as my presentation goes, I will share my screen here. Let's see if I can make this full screen. Okay, so my computer is freezing on me, but here we go. Cool. So deep learning, healthcare, and Africa. The first thing I'll say is when you think of Alliance for AI, Alliance for Africa's Intelligence, the non-profit organization that we run, we really care about two things. The first one is we're trying to improve what is possible for Black people everywhere, African people everywhere, in Africa, in Brazil, in America, in UK. And we want to help them do it with fewer resources. We don't have resources to waste. We don't have money to waste. We don't have time to waste. How can we do it faster by working together? Here's a story from 2017. In 2017, I met these founders. They're not African, of course. Enhao Gang, all of them, they're based out of Stanford in California, where I'm calling it from. And they were tackling this problem of MRI machines. You see, MRI machines are first very expensive. Secondly, it takes about 45 minutes for a picture to be captured with the MRI machine, so you can use it to try and detect whether a person has cancer or not. What Enhao and team found is that 45 minutes is such a long time imagine trying to get a baby of 2 years old or younger to sit for 45 minutes, it's hard. Or an old person or someone with a medical condition that they can't sit for that long. And so Enhao and team decided that they will find a solution that can reduce the amount of time you need and exposure to all these radioactive devices and elements. And so they used artificial intelligence and deep learning to allow you sit in the MRI for just 5 minutes. They will use AI to enhance the image, the quality of the image, to the point where it's similar to the quality that you would have done if you sat for 45 minutes. So this right here, you can imagine, saves so much more time, because now you can see many more people in the same amount of time, and you can save so much money by doing this. It was really incredible. And so when they came to NVIDIA in California, where I worked, we helped set them up with solutions architects that would help improve the quality of their work. We set them up with the government, with the policymakers, to help them figure out what is necessary and how to get the right data. And we help them set up on the cloud so they can scale to many, many hospitals that would benefit from this. So that was 3 years ago. This is last year. I decided that, we should have similar opportunities in Africa, where the people in Africa building the same incredible things can get the same kind of opportunities. Right here, you have Eric Kirima. He's from Kenya, and their company, Tambua Health, is doing similar, if not even crazier things. You can see this image in the middle. What they've done is they've taken a mobile phone. They've created this thing where they can put a mobile phone in the back of a patient. They'll capture the sound waves and use it to create an image, going from sound to computer vision, and then use that to detect respiratory diseases. So this they built before COVID-19, and you can imagine that now with COVID-19, this is one of the most important solutions that will help us, similar to what Julio just presented. You can see at the last picture, there's a jacket there that you can put on a patient, and it will capture the sound waves that they need. If you're interested in all these incredible African innovators, we have a list on our webpage at the bottom, allianceforai.org/companies, where we can find them. This is all incredibly promising, but there are a lot of challenges that these innovators face. We have to work together to take these challenges away, especially in times like this, COVID-19, where we cannot afford to be wasting resources wasting time, as these things will translate into hundreds of thousands of people losing their lives or their jobs. Two, there are so many problems, but I say two key problems are the lack of access to the key tool that's required for artificial intelligence, deep learning, machine learning, and then taking away the lack of awareness of free money and resources and opportunities that are around for everybody to use. The CombatCovid platform is an example. They provide, ample resources in terms of data, storage, cloud compute that people are not aware of. So how can we make them more aware? I'll dive deeper into some of these, but the first one is not as intuitive, but in Africa, we really don't have the basic tool for artificial intelligence. It's really the compute and the supercomputers that you use. As an example, if you want to train a deep learning model to detect COVID-19, if you build it with your laptop, it can take up to 2 months to train a model to do this useful work. And it can cost $5,000 or more. That's just an amount of money I just put together, but it will cost you actually more than that. But if you were to do this with a supercomputer on the cloud in Africa today, the easiest way to access supercomputers is with the cloud. You can see that it will reduce the time from 2 months to 2 days. And so you can innovate much faster and do so much more. And in terms of cost, it will also dramatically reduce your cost too, from $5,000 to $1,500, because now you're not paying all these expensive data scientists for 2 months, but for 2 days. And you're spending much shorter time running your training engine. The last step is, what if you had that supercomputer at your home or your office physically there? That would even reduce the costs some more, by factor of 3. That's where it's completely missing in Africa. We do not have supercomputers. Supercomputers range from small, powerful laptops of $5,000 to $2 million data center scale supercomputers. Different sizes. We can start wherever fits your pocket. This will completely transform and allow African solutions to really compete with their colleagues across the world. The second one is a lack of awareness to free money and opportunities. There's so many opportunities from CombatCovid platform, from Google Accelerator, from Amazon Accelerator, from Microsoft Accelerator. The one I have on screen here is from NVIDIA because I'm very familiar with it. When they know about innovators and startups, they provide access to tools that will save you so much time, containers that are saved, they pre-trained models. You just need to do, instead of needing to train a model from scratch, they provide you pre-trained model that has been trained 90%. You just need to do 10% to complete the work. They provide you with access to support, solutions architect that can help you think about the solutions. They provide you with discounts to these supercomputers and hardware I'm talking about. And co-marketing, right? Imagine you post on your Twitter and you have 500 followers versus NVIDIA posts on their Twitter with 5 million followers. It will reach more people and you'll be able to raise more money. So these are simple things here. I'll bring the talk to a close and take questions for myself and Julio, where I close out by saying, with Alliance for AI and our community we're building, we're really interested in helping you move along your AI journey, regardless of where you are. You might be just starting, new to AI, or you're trying to be an elite AI innovator. For all these steps, we have activities and programs that can help you move up the journey. So feel free to reach out. The website is up there. And let's all work together along with the CombatCovid platform to really give ourselves a fighting chance at thriving during and after the COVID-19 pandemic. Great. So I'll stop sharing my screen and return here to first see if there are any questions. No questions yet, but I will ask the first one for Julio. Julio, please, can you share with us the solutions you spoke about? Where are they being used today? Have they crossed the testing phase and are they being able to put in trial for hospitals?
Okay. So first I want to congratulate you for the amazing presentation, Alex.
Thank you.
Yeah. Well, from my side, we are in the phase of where doctors are testing the system. They are submitting they are submitting different images on the platform, and then see if what they are, the results that they are like giving manually is the same that the system is giving. Hello?
Yes,
Hello?
can still hear you. Can
Yes,
still hear you.
So yeah, they are testing the system. They are testing because our model needs to be improved. So and every time we need more image, so like right now in Angola we only have 1,000, and we only know it's good that we only have 1,700 COVID-19 positive. So we are searching for more images to train the model and improve the percentage of accuracy. But doctors, they are already testing the system and checking if the response of the model, of the AI model, is the same as that they are giving now. And then after that, they will approve to deploy it to the whole country.
That's really incredible. I think we'll follow up with you to find out how far this has gone. I see Nico is telling us that we should return to the main stage now for the main keynote. I'll ask that we just introduce one more person for 2 minutes, and then we'll run over there. He's similar to you, Julio, and this is the beauty of these platforms where similar minds meet and do stuff. Professor or Dr. Amo Boateng calling in from Ghana. Can you unmute yourself and please just share with the group a little bit about some of the deep learning solutions, or specifically you have around COVID-19, and just your information so that you and Julio can connect and other people on the call who are interested.
Hello, Alex. Thank you for a nice presentation and introduction. I said I'm Mark from Ghana.
If possible to put your video, that would be great as well. And I know you've just had a new daughter. Congratulations.
Thank you. Yeah. Okay. So I have my marks on so that I can't infect you guys.
Yes.
Yeah. So I'm Mark. I'm from Ghana, and like Alex said, in Africa there's a whole, should I say, barren field for AI. And for me, some of the things I've been working on is one of them is Excelix, which helps you train and run your models up to 1,200 times faster than existing systems. So it's a general black box optimization system. It runs very fast on any platform, even on mobile phones. Yeah, and the algorithm was developed by myself when I was doing my PhD, whereas I didn't have any supercomputer. So I developed a new algorithm to make models run as fast as running on supercomputers. It's lightweight. It's able to, it's really small. It runs on almost any system, Raspberry Pi, Arduino, mobile phones, and it's able to handle, so far on my laptop, I've been able to do a 1 billion parameter training on my laptop. And that was done in just 18 hours compared to what Google did with 1,000 servers in 1 week. So that's one of them. The other one, which is a general one that is up there, is I call the AI country monitor, which takes all the data from all the cases from the world, and the AI analyzes the patterns and tell which stage each country is at in the COVID-19. So it's currently grouping them into 3 and into 10 classes. So we have those who are still peaking, they should expect more cases. And the countries that are, they've passed their peak and their cases are coming down, and those that have their COVID under control. So it's on GitHub. So if you go to AICountryMonitor.org, you find these countries. It's also for US too. So if you do /USA, you find that data. In addition, there's also
I'll give you opportunity for just one more, so we'll go to the main page.
yeah. So there's also the AI using the smartphone as your main processor. So you take an X-ray image, you take a snapshot of your smartphone, then it diagnoses whether you have COVID or any other respiratory illnesses. Yeah.
Incredible. African innovators using deep learning for healthcare. The future is bright. The future is brighter if you guys all get involved and you inform those who are capable of providing the funding and resources that every one of us needs. But until then, we will continue to collaborate, minimize silos, and grow together. To that, I call on you all to please follow the Zoom link on the chat window. Let's head back and hear the closing keynotes. Thank you for joining the session. Cheers.